Good day. Our lecture for this afternoon would be alternative and traditional medicine. So what is alternative? And what is alternative medicine? So meaning this is not a mainstream option when it comes to treating illnesses in medicine. So this is any practice that is put forward as having the healing effects of medicine but does not originate from evidence gathered using the scientific method. So it is a $48 billion per year industries and has been shown that 33% of Americans use alternative medicine, and same way with the global situation. 38% of adults has used some form of complementary alternative medicine. Patterns of those who use these medicines usually include women of higher education, hospitalized within the past year, former smokers, back, neck, head, and joint pains, and gastrointestinal disorders or sleeping problems. So if you will see, it is not demographic, usually higher educated, and usually has chronic illnesses that cannot be treated by medicine. These are the 10 most common therapies used. So 17.7% would be natural products, deep breathing, then followed by meditation, chiropractic medicine, massage, yoga, and down the line. Complementary medicine is used together with conventional medicine. Examples are anxiolytics and massage therapy used for anxiety. Alternative medicine is using it in place of conventional medicine. So the holistic approach focuses on treating the whole body and the mind. So we have different alternative medical systems. The traditional Chinese medicine would be a balance of qi, usually represented by acupuncture, herbal medicine, massage, and qigong. Ayurveda is from your culture. It began thousands of years ago in India, and it aims to restore harmony by questioning, observing, touching, and classifying patients. Homeopathy is the unconventional Western system based on the idea that like cures like. This would include herbal medicine, minerals, and chemicals in diluted forms to kill or ward off illness. Naturopathy restores health rather than cure disease. So this is your diet, maintaining good nutrition, homeopathy, acupuncture, herbal medicines, hydrotherapy, manipulation, and physical therapy. So there is a naturopathic doctor degree. So I would ask you to divide into 5 groups and have a reporting on these following systems. So alternative medical systems, mind-body interventions, biologically based therapies, manipulation, body-based methods, and energy therapies. More on that assignment later. So manipulative and body-based practices are based on manipulation or movement of one or more body parts. Energy medicine would involve the use of energy fields, such as magnetic fields or biofields. Mind-body medicine uses a variety of techniques designed to enhance the mind's ability to affect body function and symptoms. Biologically based practices use substances found in nature, such as herbs, special diets, or vitamins, and the whole medical systems are built upon complete systems of theory and practice. Often, these systems have evolved apart from and earlier than the conventional medical approach in the United States. So these would be the classifications of your alternative medical systems: mind-body intervention, biological-based therapies, manipulative and body-based methods, and energy therapies, which we will discuss in our later slides. So, traditional Chinese medicine mainly depends on yin and yang. So these are two abstract and complementary aspects that every phenomenon in the universe can be divided into: female, male, moon, sun, etc., etc. Insufficiency would explain symptoms of disease. So a decrease in yin would have an insufficiency, so heat sensations, night sweats, insomnia, and yang insufficiency would lead to aversion to cold, cold limbs, bright complexion, etc. So these are the 5 phase elements of your yin and yang. So all phenomena of the universe and nature can be broken down into 5 elemental qualities. So 5 phases or elements would be wood, fire, earth, metal, and water. So in the model of the body, vital energy or your qi circulates through channels called meridians that have branches connected to bodily organs and functions. The tendency of Chinese thought is to seek out dynamic functional activity rather than to look for the mixed somatic structures that perform the activities. Because of this, the Chinese have no system of anatomy comparable to that of the West. Their concept of disease entities listed constitute only symptoms. Therapy is not chosen according to disease but according to the pattern. Hence, two people with the same disease entity but different patterns will receive different therapy. So we have 6 excesses. So wind would have rapid onset of symptoms, nasal congestion, tremor, paralysis, convulsion. Excess of cold would produce the following: excess of fire, aversion to heat, fever, thirst, red face, red tongue, etc. Dampness, a sensation of heaviness, sensation of fullness. Dryness would have dry cough, etc. Summer heat would either heat or mixed damp heat symptoms. Then we have mind-body interventions. The first example of which would be acupuncture, which is an ancient Chinese practice of inserting needles in specific points on the body to manipulate the flow of energy or qi. So this is an example of acupuncture, and where you are supposed to place the needle to prevent block of qi in different parts of your body. Qi was believed to flow from the body's primary organs to the superficial body tissues of the skin, muscles, tendons, bones, and joints through channels called meridians. Acupuncture joints where needles are inserted are mainly found at locations along the meridians. Scientific basis attribute pain relief to the release of endorphins when needles penetrate, but no longer support the idea that acupuncture can affect a disease. Mechanical deformation of the skin by acupuncture needles appears to result in the release of adenosine. Effects in gastrointestinal disorders may relate to its effects on the parasympathetic and sympathetic nervous system, which have been said to be the Western medicine equivalent of yin and yang. So many acupuncturists attribute pain release to the release of endorphins. So what would this happen would be when needles penetrate, endorphins would then be released. It promotes gastric peristalsis in subjects with low initial gastric motility and suppresses peristalsis in subjects with active initial motility. Neuroimaging studies show that stimulation results in deactivation of the limbic brain areas and the default mode network. So meta-analysis and studies would show that acupuncture would be clinically relevant, but an important part of these total effects is not due to issues crucial to acupuncturists, but are associated with more potent placebo or context effects. So there's high-quality evidence that suggests acupuncture is effective for some, but not all kinds of pain, and this is through Cochrane reviews. Aromatherapy is also one mind over matter, and yoga is also one example of meditation that brings about clearness of the mind and body. So it is a practice in which an individual trains the mind or induces a mode of consciousness, either to realize some benefit or for the mind to simply acknowledge its content without becoming identified with that content. Then we have mindfulness meditation. Mindfulness meditation reduces anxiety, depression, and pain. We become aware of what is currently happening around the practitioner as opposed to focusing on something different than the present. It lets go of mental attachments and worries. So this is meditation so that we could reach our spiritual level. So hypnosis is a state of human consciousness involving focused attention and reduced peripheral awareness and an enhanced capacity for response to suggestion. So this is a cartoon character which is known for hypnosis. This is a very old cartoon which shows your professor's age. So it shows the power of suggestion to a person for you to follow one's commands. Then we have biologically based therapies. So these are mainly dietary supplements, which is rampant in the market right now. And these promises women to be more beautiful, lose weight, for men to build more muscle, to be more intelligent, improve memory. So there are lots. And it's, again, a billion-dollar industry. So these are, in short, herbal medicines, and we have been using it for thousands of years. But, case in point, just because something is natural, it does not necessarily mean it is safe. So herbal remedies are not to be taken. And special supplements would show that not all supplements are plant derivatives. Increasing reports in the media on the health benefits of various vitamins, minerals, amino acids, and other specific biological compounds are abundant. Functional foods, these are what you read in your news as antioxidants, are foods or supplements designed to improve some specific aspect of physical or mental functioning. And this evolved into a billion-dollar industry. Again, nutraceuticals which provide combined nutritional and pharmaceutical benefit. Strategies to protect supplement consumers' health. Again, always talk to your doctor and do your homework. So you have been taught to appraise journals, know what your evidence tells you. So we have to advocate for more stringent FDA approval and look for the USP or supplement verified seal. So may be safe, but efficacy is unclear. So this would be like the acupuncture for chronic pain, etc. Or less effective, dangerous or ineffective, treatment examples of which would be unapproved injections of unapproved substance, toxic herbs, delaying treatment, taking herbs known to interact dangerously with conventional medicines, etc. But for extreme purposes, we have unapproved substances to treat coronavirus, and that is for compassion use. So, likely safe and effective, you want it to be in this category. So, chiropractic for acute low back pain, acupuncture for nausea from chemo, etc. Or may work, but safety is not certain. St. John's wort for depression, saw palmetto for an enlarged prostate, and the like. And there's a special Ayurvedic massage which says that it stimulates the lymphatic system to expel toxins out from the body so that lymphocytes may be produced. It is particularly useful for pain relief, reduction of fatigue, prevent aging, to bestow longevity. There's a Swedish or classic massage which has 5 basic strokes: the sliding or gliding, kneading, rhythmic tapping, cross fiber or with the fibers, and shaking. So this helps in reducing pain, stiffness, and improves function in patients with osteoarthritis of the knee over a period of 8 weeks. This effectively reduces low back pain, and the effectiveness can last for as long as 15 weeks. Thigh massage. It's a deep full body massage progressing from the feet up, focuses on the sen or energy lines throughout the body with the aim of cleaning blockages in these lines. It stimulates the flow of blood and lymph throughout the body. And then we have reflexology. It is the gentle manipulation or pressing on certain parts of the foot to produce an effect elsewhere in the body. So the best evidence available for this does not demonstrate convincingly that reflexology is an effective treatment for any medical condition. Then we have chiropractic treatment. Chiropractic treatments usually involve spinal manipulation, and it's a treatment that uses pressure on a joint of the spine. It is also called spinal adjustment. Chiropractic medicine is the diagnosis and treatment of mechanical disorders of the musculoskeletal system, especially the spine. Manipulation is the passive manual maneuver during which a joint complex is taken past the normal range of movement but not so far as to dislocate or damage the joint. So these are some of the conditions that chiropractic may be able to help you with. Cupping. It's the procedure commonly involving creating a small area of low air pressure next to the skin and would remove the heat from your body and cold. It's a type of Chinese massage consisting of placing several glass cups on the body. A match is lit and placed inside the cup and then removed before placing the cup against the skin. As the air in the cup is heated, it expands and after placing in the skin, cools, creating lower pressure inside the cup that allows the cup to stick to the skin via suction. It has not been found to be effective for the treatment of any disease. So reflexology, we've had that in the previous chapter. An alternative medicine involving application of pressure to the feet and hands with specific thumb, finger, and hand techniques without the use of oil. And energy medicine focuses either on energy fields thought to originate within the body or on fields from other sources. So we have crystal healing. It's a pseudoscientific alternative medicine technique that employs stones and crystals. So we have your equivalents here. Crown is for spiritual, third eye is for perception, throat is for expression, heart is love, sacral is sex, solar plexus is for power, root is for the survival. Electromagnetic therapy is a pseudoscientific form of alternative medicine which claims to treat disease by applying electromagnetic radiation or pulsed electromagnetic fields to the body. Scientific basis of which would be placing a magnetic field, thereby separating the cells, thereby lessening the blood pressure in the arteries. Faith healing is a method of treating diseases by prayer and exercise of faith in God. So how does it work? Power of suggestion. So you suggest and your mantra, your chakra would do the rest for you if you believe in your upper deity. Feng Shui, it's the order of which we put our objects or places. And your Qigong is a holistic system of coordinated body posture and movement, breathing and meditation used for health, spirituality, and martial arts training. So this is usually used for hypertension, diabetes, and pain management with the following results. Pranic healing, highly evolved and tested system of energy medicine developed by Choa Kok Sui that utilizes prana to balance and harmonize body. Okay, so suggested you read on the following resources and look at the specific supplement, or you could choose your own supplement and make an infographic about said alternative medicine. Thank you for listening to this lecture. Subscribe to my channel for more lectures on preventive medicine and community health. Thank you.